After the horrors that healthcare workers have endured during the pandemic, many are struggling to sympathise with people who won't get vaccinated. Doctors in South Africa are pleading with patients to get jabbed, as those ending up in ICU with severe symptoms are mainly unvaccinated. Strained doctors and healthcare workers say they're now succumbing to compassion fatigue. CGTN's Scheier met up with Infectious Diseases Specialist Dr. Helen Van Der Plas.
Dr. Helen Van Der Plas works at a private hospital in Cape Town. She describes the past 18 months as harrowing.
After the third wave, we have seen an enormous amount of patients being admitted, requiring oxygen therapy and standard of care, steroids and subsequent intubation ventilation. And it's been absolutely harrowing. These patients, they just require a huge amounts of care. They're isolated from their loved ones. They die alone. What we've seen is patients go intubated, ventilated, and unfortunately progress to the morgue. We only see ventilated patients that have not been vaccinated. So these are unvaccinated. And of course, since June, not everybody had access to vaccines and so on. But we're still seeing, unfortunately, patients now being admitted that still are not vaccinated and who had opportunities to go. Many of these deaths are now preventable, and also they consume enormous amount of resources. Hospitalized, ventilated, subsequent infections, hospital-associated infections and healthcare-associated infections that they get. And if they do come out, it takes several months for them to recover in full, if they do. It is beyond comprehension and logic-defying. I mean, to date, close to 6 billion vaccines have been administered, of which, 2.5 billion people are fully vaccinated. And it's the biggest scientific project we've seen in the shortest period of time ever. Hesitancy, I understand, that's really just education and further questioning where the concerns are. But the complete anti-vaxxer stance is beyond comprehension. It's a real struggle. I understand there's a concept of compassion fatigue and there's resentment, but I think taking a step back, one has to analyze these emotions, and I think it's real. We understand it, but we still have to care, and we will care for patients that will not accept our healthcare message to prevent this infection in the first instance.
Scheier, CGTN, Cape Town, South Africa.